a wheelchair, crutches, or other unfamiliar items. Later, you will learn simple exercises to strengthen your body and promote healing, as well as desensitizing and stretching the residual limb to prepare it for the prosthetic fitting. The first time you see a prosthetist, it will be an opportunity to talk and ask questions. The prosthetist will also want to look at your healing limb and discuss the process of being fit with. Several weeks into your recovery, you'll be ready to schedule an appointment with your prosthetist to begin fitting your initial prosthesis. At your first visit, you will need to bring. The prosthetist will take a look at the residual limb to evaluate how well it's healing and determine if you're ready to be fit with a prosthesis. Keep in mind that there's no exact timetable for healing. The next step will be creating a precise mold for the prosthetic socket. The socket is the part of the prosthesis that connects to your body. There are a couple of techniques for capturing the shape of the limb, and your clinician will decide which one is right for you. One method is hands-on plaster casting, where the limb is carefully wrapped to form an exact mold. Another way is done with a handheld laser scanner that traces the shape of the limb and stores it in a computer. Again, your prosthetist will determine the best approach for your specific amputation. A clear diagnostic test socket will first be created to ensure the fit is accurate. Adjustments may be made to accommodate any areas that may not be fitting properly. The initial socket will be used for a fairly short period of time, usually 3 to 12 months, until the swelling is gone and your limb has settled into its final shape and size. Experienced prosthetic user, you'll be able to talk with your prosthetist in detail about what's working well and what you wish could be improved. Their goal is to help you reach your goals. Sometimes there are special circumstances that can delay fitting the permanent prosthesis. It's not unusual for people with health problems or other challenges to use their initial prosthesis a little longer. It may be necessary to make a new socket now that your residual limb has been conditioned and has settled into its final shape and size. Your prosthetist will evaluate the fit and make modifications as needed. In some cases, it may be necessary to use a liner between the skin and the socket. Possible. Once you are wearing your permanent prosthesis, it may be necessary to have another round of physical or occupational therapy. The therapist may identify some problems you might not be aware of and can help refine and improve the way you move and use your prosthesis.